is Dr. Jesse Schulz. I'm a physical therapist. I work out of Mukwonago, Wisconsin. And while I typically make most of my videos in the clinic that I work out of, I decided today to do this one in my home to show you how easy it is to do this type of exercise in a home, not necessarily just in a gym setting. And this video is going to be about lunges, which I find to be probably one of the best exercises for strengthening the buttock muscles, the back muscles, the leg muscles in a very functional sort of way. If you have the option of doing a squat and you really want to get a lot of power, squats are a fantastic exercise to do, along with a lot of the kind of power lifting moves like the power clean, the jerk, the clean and press. But if you're the average athlete, or if you're someone who's trying to get stronger legs, lunges are so functional for doing things out on the athletic field and doing things during the course of your day. What I'll be showing you today is a progression of lunges to help you get slowly, progressively stronger and just better control of your body. Now, there's only a few things with lunges that you need to keep in mind. Number one, when you're doing a lunge, you want to keep your back straight, and at least for the first couple portions of this, you want to keep your back also vertical. You want to make sure that you have the weight on the front heel when you're taking a step, or the stepping leg's heel, because when you do that, it's going to help activate the gluteus muscles better, your butt muscles. When we progress to the variations of the lunge, then we can talk more about kind of movement of your body and things like that. But the first stage is just a stationary lunge. Now, there's two different lunges that I recommend in stage one. One would be a stationary forward lunge, and the second would be a stationary side lunge. Now, for the forward lunge, you take a long step forward. You're going to lift your back heel as you drop your knee back straight towards the floor. So down and up. Your pelvis should stay level. Your weight should be heavy on the front heel. And from the side view, I find this to be most important for most people. Again, your back should be straight and vertical. Sometimes people will arch their back, or they'll go forward. If that's the case, you may have a muscle asymmetry that may need some manual therapy to be corrected, or you may have some weakness that you just need to do some other exercises to address. If you don't know what other exercises to address this sort of problem, what you could do is just go down less far. Now, lunges, like any other exercise, are not appropriate for all people, but I generally do find them to be fairly safe. So consult with your doctor or your physical therapist to see if lunges as a whole are a safe option for you. Now, I just showed you the stationary forward lunge. Now I'm going to show you the stationary side lunge or lateral lunge. So with your feet very long, spread apart, you're going to bend only one knee, my right knee, to lunge down and come back up. I'm keeping the weight up heavy on the right heel as I'm loading the right leg and pushing off from it. Again, for these, you want to keep your back straight and vertical. And what you'll see from the side view, hopefully, is my back is straight and vertical, and in addition to that, my butt's coming back. Now, if you keep the weight too much on your toes, your knee will come forward. If that happens, you're loading up the wrong muscles and it'll put a lot more strain on your knee. Once you can do 2 to 3 sets per leg of the forward and lateral lunge of about 15 to 20 repetitions, you're probably ready to move on to the next step, stage 2, the stepping forward and lateral lunge. But now what we're also going to do is add in a stepping backward on a diagonal lunge. So essentially all the same principles are in place with keeping the weight on your heel and also keeping your back straight and vertical. But now we're going to be more dynamic. We're going to be moving. So you're going to step down and come back up. You can alternate legs if you want, or if you would prefer, you can just do all of them on one side and then repeat on the other. So that's a forward lunge. For the lateral lunge, step down and back up. You don't necessarily have to go as fast as I'm doing this right now, but as you do get stronger, you can go faster if you want to for more explosiveness, if you have enough strength. Now, if you don't want to go any further than this step, what you could do is do the stationary lunges and or these with weight. By adding weight, you're going to get stronger by just doing the same number of repetitions as you were before. But if you would like to progress yourself to the next stage, I highly encourage it because I think there's a lot more benefits. But before I talk about stage 3, we have one more stage 2 lunge to do, and this is new for you, and this is a backward diagonal lunge. So you're going to start by standing facing this way with one foot. I'm just going to show it with my right. You're going to step backwards on a 45-degree angle. This foot's going to stay planted. So I'm going to step back, and then you're going to lunge by just bending the front knee and step back. Keeping the weight heavy on the heel of the right leg as I'm doing this. Now, again, before you move on to stage 3, I would encourage you to be able to do these exercises for at least 15 to 20 repetitions per leg for 3 sets. You don't necessarily have to do it with any weight before you progress to stage 3, but I would highly recommend it. Now, stage 3, we're going to be adding one new movement, the crossover lunge. You're going to be stepping across the middle. You're going to be lunging down and coming back up. This will load up more of the muscles through here. So you'll get a stretch through those muscles as the muscles are activating, which is called the eccentric contraction, which will help them actually feel looser after you're done, in addition to getting them stronger. So, the crossover lunge, keeping the weight heavy on the stepping leg's heel. And of course, you could do this on the other side as well. And then we're going to come back to the 3 lunges I've already shown you. The forward lunge, the lateral lunge, and the backwards diagonal lunge. And here's how we're going to change these now. As you're doing the lunge that you've already been accustomed to, you take your step, you lunge down. Now, you're going to hinge forward at the hips to reach towards the ground before you come back up. Step forward, keep your back straight, hinge at the hips to reach towards the ground, and come back up. Now, of course, again, you would want to do that on both sides. And again, whether you alternate one on the left leg, then one on the right, or if you do all of them on the left before switching to the right, that is your choice. For the lateral lunges, I recommend you take a step with your foot on a 45-degree angle for this. It makes it feel more natural. Take a step to the side, only bend this knee, and then lunge down towards the floor, keeping your back straight before you come back. Same thing on the other side. And then the last exercise again, the backwards diagonal lunge with the hip hinge. So keeping one foot planted, trying to keep it pointed straight ahead, step backwards on that diagonal, bend only the leg that you have taken the step with, keeping the weight on the heel. As you keep your back straight, hinge towards the ground, then come back. But that's a progression for lunges that I recommend and that I do myself. Again, with any of these exercises, you can use weight. Follow up with your medical doctor and or your physical therapist to see if doing an exercise program is appropriate for you and or if these exercises are appropriate for you.